is one of the very infectious problem that is common. A lot of people have that problem, and therefore it's very common to be tested. It's caused by a bacteria called Mycobacterium. So the name of the bacteria is Mycobacterium tuberculosis. So, and it's a bacteria, and usually it's transmitted by airborne. Somebody cough, and then you get infected with that. There is two forms of infection. There is a latent form and the active form. The latent form just means that you tested positive for PPD. Okay, tuberculosis basically you tested positive for without any symptoms. So without any symptoms. And the TB, active TB is when you have active symptoms. You tested positive for PPD, and then you have symptoms in addition. So there is a distinguishing that you have to know in terms of what is a latent TB and active TB. So when somebody get infected, you get into the system, your body fight against the infection, and you store these bacteria mostly in your lung as granulomas in your lungs, and they become latent and become dormant. That's what it means. When you get older or you become immunocompromised, like you have HIV or basically you take any medication in lower your immune system, and they can activate this latent TB to become active TB. So that's all what it means. The two difference. Well, you have to know how they present and how they test it. Okay, latent TB, they have no symptoms. And usually we test it using a TB testing. So TB testing. And that's you've seen it before, the Martos test. So in your exams, when you see TST, it means tubercular skin test. And what they use is they take the purified form of the protein of the bacteria. So the PPD means purified, they've purified it. Okay, protein derivative. So that's what it means, PPD. Of the bacteria that causes the TB. So they inject it under your skin transdermally, and they use 0.1 ml of that and inject it. You have to know in fundamentals, you have to know how much you inject, and then the angle is like 15 degrees. So it shouldn't be more than 15 degrees because it's going in transdermal. So it's a transdermal injection. And then you come in and then you go back 48 to 72 hours for it to be read. It becomes positive if there's induration. So be careful. They can trick you and they put erythema. Induration means it's positive. And you're looking for maybe like 15 millimeters induration. So this is how the PPD is done. And you're looking for 15 millimeter induration. Erythema is not. You expect to have some small erythema, but induration, you're looking for like bump about 15 millimeters, which is 1.5 centimeters basically. Okay, so that's what they do for and if this is positive, and without symptoms, no symptoms, that's latent TB. That means you have latent TB. They usually get a chest X-ray to make sure that there's no active infection in your chest X-ray, and then you'll be considered latent TB. They can ask you questions. This is a testable question. So these patients, they are not infectious. Otherwise, we will be all be in isolation. Just having a latent TB, just testing PPD positive, you are not infectious. Okay, so these patients are not infectious, and they are not contagious either. Okay, so you don't need to isolate them. They just have the bacteria in them, but the bacteria is latent. So that's what it means. Active TB means you have tested positive and you have symptoms. And what are the symptoms? The symptoms are common. We call it, the way I remember is B, TB. So B symptoms. B symptoms is the name they use it for, like a lymphoma, leukemia. So you can use both information, try to remember it. So this is all pathophysiology. So they have B symptoms. The B symptoms, you see active TB. So there's TB, tuberculosis B. B symptoms, they have like night sweat. So and they have weight lost. Those are all B symptoms. Okay, and they will have anorexia. Okay, and they get fatigue. This is common for patients who have like lymphoma, leukemia. They develop these base symptoms. But for tuberculosis, they can have cough. So they may have cough, and there may be some blood thing. Um, there may be some blood in it, a little bit of blood. So this is active. But B symptoms with the cough. So night sweats, that's how you can remember. If you know what B symptoms are, night sweats, weight loss, anorexia, and fatigue, common to lymphoma, and you can remember that. And then you add cough to it, that is active TB. How do we diagnose active TB? Well, they need a sputum test. They need a sputum test. So it's a sputum test. You have to cough it out, okay? And they have to test it, and they have to do a culture and a smear of the sputum. And usually the test they look for positive acid fast test. So acid fast. So AF, or I'll write everything, acid fast test. And that will show that you have active TB, okay? It is very important to understand that the sputum, the time you collect the sputum is very important. So early in the morning, AM, let them wake up early in the morning, let them goggle their mouth and take all the bacteria off. You can't just wake up and then you take the sputum from their mouth. They may have bacteria in their mouth already. You don't want it to be contaminated. So let them wash their mouth. It's okay. So wash mouth, and then let them give you a clean sputum. And you need 3 of them, okay? 3 sputum to confirm. So this confirmed diagnosis. So the confirmation of TB for active TB is 3 morning. It's morning sputum, no afternoon, no evening. Morning sputum. But make sure you let them wash their mouth before you get it. Okay, so that is the confirmation of the test, and this takes some time for you to get the results. So, but these patients, as soon as you suspect, anybody suspect of having active TB, isolation. So you isolate them right away before you get the results back. So that's it. So we talk about the side effect, this thing, the what usually involved with TB and other things. So we'll talk about it. The other thing I want to say before I talk about transmission, I said something about the TB, the tuberculosis test. Sorry, this thing. So we did a tuberculosis skin test. There's another test, okay, that you can do. If you see it on your test, is quantiferon. That's another, if you've heard it before, quantiferon test. This is another diagnostic, I mean, is the screening. They are all screening tests. The TB test, this is the screening. The sputum is for confirmation. So confirmation. So another screening. If you don't do the skin test, you can do quantiferum. There's few things you have to know with quantiferum. This is a blood test, so it's not a skin test anymore. And usually it's very expensive because it's a blood test. That's why we don't do it that much. But if you see in your test, you just need to know a little bit about it. It's a blood test, and then they draw your blood, they send it to the lab, and they do it. It's a very quick turnaround, 48 hours. Therefore, you don't need to come back. So you don't need to come back. No, come back for the results. No, the doctor can call you. You don't have to. They have to read it again. They draw the test and they do it. So it's a single visit. So this is a single. So if it's inconvenient, the doctor will do it. But there's just to let you know, there's something called quantiferon test. It's not the same as tuberculosis skin test. And this is usually blood test. It's expensive. It's a one-day problem. You don't have to come back and do it again. Now, transmission. Okay, this is infectious control. This is airborne. So you know there's three types. It's a contact, airborne, and droplets. So this is airborne. In your exams, you try to make it easy in your brain, and like so that you can stay focused. There's when we say transmission precaution, anybody that come to the hospital need a standard precaution. Standard precaution means you wear gloves, you wear gown, and you wear masks and everything. Everybody needs standard. You want to prevent infection as much as possible. But when they said that standard precaution, everybody, you got to make sure you maintain hygiene, you're washing your hands if you have to touch something. So those are all standard. If you need to wear gloves to give injection, yeah, you get to do standard precaution. But when they specifically ask you for transmission precaution, they have grouped these diseases that can be transmitted from one place to another specifically. That's what they're asking. So for airborne, basically, the reason why is an airborne is the particle, when you cough it, can stay in the air for a long time, more than 3 feet. So it can stay, it's not droplet. So it can stay in the air for a long time. And so it can, and it's very small, it can penetrate certain marks. So it takes a long time for it to get out of the system. It's airborne, like Superman. Superman can stay all the way in the air for a long time. And therefore, these organisms, you need to have specific things to do. So when they ask you transmission precaution, just you group them into a certain way. So transmission precaution, every transmission precaution for organism that is airborne need a special mask. So they need the N95. N95 means you wear a mask, certain masks that will prevent passage of the bacteria 95% of the time. So at least 5% passes by 95%. The 95 is who is wearing it. That's where they trick you at. It's you, the nurse, you protecting yourself. Wearing N95 doesn't protect the patient. The transmission precaution is talking about you taking the infection from the patient and sending it somewhere. So you have to wear the N95 mask, okay? Then the patient has to be placed in the pressured negative pressure room. So pressured negative room. And they have to be alone so that they don't give it to another patient. So it's private. You see what I've done? I just made it the way it's supposed to be. You're just thinking about it. So 95 N95 to protect the nurse. They need to stay in the negative pressure room so that it can suck the bacteria out of the hospital so that it doesn't spread. It suck it out and it go outside the hospital instead of staying in. And the patient has to be alone in a private room. But then this is I want you to pay attention. If they're going for any diagnostic test is like they're going to get like X-ray or CT scan, any diagnostic test. Now the patient, patient, because he's leaving the negative room, patient has to have just a surgical mask. So for any airborne disease, N95 for the nurse, patient in a negative pressure room, they're in the private room, and the door need to be closed. Door completely closed. Door is closed. They are in the pressure room, in private room, door closed. If you're going for diagnostic test, they have to wear surgical mask. If in their room, if this is the patient room, there is a back door. So because their regular door is closed, this is the door that go into the come into the maybe the hallway where the nurses are sitting. This door will be completely closed. So there will be a back door and patient will be here like that. So this back door go to another room. So you don't go through this. So this door is closed. This door is completely closed. So you go through here and you wear your mask, you wear your N95. So most of the N95 is all here. You wear here, then you go to this, there will be another door here, and you pass here, and you go to then see the patient. And then when you finish, you go the same way. You come here, stay here, and take your mask off, and then come out of this room. This door remain closed. So you can go here to this room and observe the patient. So there have to be a break room or a side room, that you can observe the patient, or a second room where you can go without even entering the patient room and observe them if something is happening. If you need to go in, you just wear your mask there and you enter. But the main door is completely closed. So that's the transmission precaution for that. Because that's all that you need to know for that. And they can trick you. They can trick you and they will write it, but you just have to stay N95, for the next surgical mask if you're going for diagnostic test and all the things that I've said. That's all you need to know.